My name is Rachel Carruthers, and I'm the Events Manager here at the Portland Regional Chamber of Commerce. Welcome to Growth Basics for Business, a monthly breakfast seminar series which provides a forum to gain useful do-it-yourself workplace solutions and insightful, actionable tips. I want to thank Eaton Peabody Partners for their continued support of this virtual event series for the entire season. Today's topic, Supporting Mind and Body, Prioritizing Mental and Physical Wellness in Business, is presented by Leslie Willett-Todd, owner and registered dietitian at Nourish Lifestyles, and Michelle Joubert, Executive Clinical Director of Ellie Mental Health. Leslie and Michelle will discuss what it looks like to integrate mental and nutritional health in your daily routine, the results you should expect to see, and how to discover what your own employer offers through benefits or other avenues to help you along your journey. Like all the Chamber's virtual signature events, today's presentation is free and is being recorded. It will be made available for free replay on the Chamber's website and YouTube page. To keep up to date on all the Chamber's news and events, visit our website, portlandregion.com. Check out our events page and sign up for our weekly email newsletter while you're there. Before we begin today's program, I just want to remind everyone that we are using StreamYard. StreamYard this morning. This platform provides improved production and interactive elements that truly enhance virtual events. On that note, I'd like to point out that when you have questions for our presenter today, you can type them in the YouTube chat. They'll be relayed to Leslie and Michelle, and we'll also save time for Q&A at the conclusion of the event. At this point, I'd like to acknowledge our presenting sponsor of Growth Basics for Business, Eaton Peabody. For the past 6+ years, Eaton Peabody has been the presenting sponsor of this series, and they continue their support again this season. Eaton Peabody is a full-service, Maine-based law firm with nearly 50 attorneys serving Maine clients from offices in Augusta, Bangor, Ellsworth, and Portland. They assist companies of all sizes in a variety of industries, so whether you're an established financial institution or a small business taking the first steps, they can help you with your legal needs. To learn more about the services that they provide and the industries that they serve, please visit their website, eatonpeabody.com. Also be sure to follow them on Facebook and LinkedIn to stay up to date on legal updates and future presentations. Now, I would like to give a little bit more information on our presenters today before we get started. Leslie Willett-Todd is the owner and manager of Nourish Lifestyles, a group private practice of 5 registered dietitians. She holds master's degrees in human nutrition and public health and is a registered dietitian. In addition to running the private practice, she is an adjunct faculty at the University of Maine, teaching clinical nutrition to graduate students. She's also a research collaborator with the College of Osteopathic Medicine at the University of New England, developing lifestyle medicine pilot programs that train future doctors on culinary medicine. She has focused her expertise in teaching individuals and families how to eat healthy on a limited budget. Besides family eating, Leslie is passionate about supporting women in achieving body acceptance and focuses on the non-diet approach. She believes that food should be something to enjoy, not fear. Michelle Joubert is the Executive Clinic Director at Ellie Mental Health Greater Portland. She received her master's in dance movement therapy and mental health counseling from Antioch University, New England in 2006. In her role at Ellie, she is responsible for running the clinic's day-to-day operations, including providing clinical supervision and carrying a caseload of clients. With 17 years of clinical experience, Michelle has worked in diverse settings with people of all ages experiencing various life stressors. In addition to direct clinical work, Michelle has had experience as an adjunct professor in quality improvement, running supervision groups, presenting at conferences, and directing a children's residential program. Michelle believes in the importance of having a supportive, accepting, and creative work culture in which both employees and clients can show up authentically. Now that you've heard enough from me, Leslie, Michelle, I'll hand the mic off to you. Take it away.
Thank you, Rachel. We're so glad that everyone can join us this morning. I'm so happy we're sharing breakfast together. Today, Michelle and I will be digging into how employers and employees too can change their the culture of their workplace to promote health while also benefiting business. Michelle and I have a few objectives for today's presentation. We hope after today you will understand the role your organizational culture plays in fostering employee well-being. You will gain a better understanding of the data we have that supports why investing in employee health is beneficial for both individual employees, but also for the business. Lastly, you will leave the presentation with strategies and resources to shift the culture of your workplace to support more mental and physical health. To make this presentation a little more engaging, we're gonna ask that you participate in a few polls that we have throughout the presentation. To participate, we're gonna put a link in the chat. And if you just click that link and keep the browser window open throughout the whole presentation, the polls will reset and you'll easily be able to participate. All right, let's get started. Just out of curiosity, what made you register for our event? So again, if you click on the link, it will bring open a browser. And you can also text if you want to. There's directions on the top of the slide. We'll just wait a couple minutes or a couple seconds for people to start responding. You guys haven't had a full cup of coffee yet? There we go. Seems like good knowledge to gain. Absolutely. I'm interested in more balance. Yes. Definitely interested in creating work-life balance. Understanding health benefits. We're going to talk a lot about our insurance, our health insurance benefits. Supporting fellow linkers. Great information to have. Awesome. Thank you guys so much for responding. This information is really helpful. Understanding why you're here is important to us.
Good morning, everyone. Thanks for joining us. I know Leslie already said that, but this is my first time talking to you. Leslie and I are going to start with integrating practices into our workday from both the mental and physical health aspects. We know that most people have extremely busy lives and that asking employers to do one more thing seems like a lot. But there are some really low barrier strategies that we can start focusing on and working to implement in the workday to help us thrive instead of just surviving at work. But first, we're going to start with another poll question. So get ready to answer. And this one, you don't have to think so much. It's just a yes, no, or sometimes question. So it looks like we have about a 50-50 right now with people feeling that mental health is integrated in their day-to-day workplace. Give it a couple more seconds and see how it changes. We have some good results here, looking like a lot of people feel that mental health is integrated into their workplace, which is really nice to see. Some of the data nationally, there's a little bit of a shift, and it's more of a no, that they don't really think about how that's focused on a day-to-day basis. This is some data on why mental health in the workplace is important. We're not doing our workforce any favors when there's 76% of workers surveyed reporting at least one symptom of a mental health condition. That's not necessarily from a professional, but their own experience of a mental health condition. So 76% of people that you work with are experiencing some type of stressor. And 84% of people say that work has contributed to their mental health challenges, whether that's expectations at work, stressors at work, relationships at work. There's lots of different things that can impact that, not feeling supported. And 84% of workers nationally say that their work has contributed to mental health. So employers' ears should perk up when they read that 81% of those surveyed reported they were looking for a workplace that supports their mental health. It sounds like many of you have a supportive mental health workplace, which is great to hear. Workers want support, but what does it mean and how do we give that to them? So integrating mental health into your day-to-day business, we are looking at a little bit more data here. 41% of employees feel pressure to constantly be available. And that's especially true of the online or remote work employees. One third of employees feel tired from being constantly online, so lots of meetings, looking at their screens all day long. 55% of employees said they were unsure or disagreed with their company's leadership in understanding their mental health needs. And what that means is that leaders in either HR or management positions felt that they were understanding of the employees' mental health needs, but the employees themselves either were unsure that they actually understood or disagreed with them. 65% of employees say their main manager plays a huge role in their mental health, and that speaks to those relationships and the importance of managers being educated as well as being able to have empathy for people so that they feel that they can go to their supervisors and managers and talk with them when needed. 62% of employees expressed feeling lonely. That is contributed by isolation in terms of working remotely. It can be something happening in their personal lives, but feeling disconnected from their coworkers when they are in the office. So, we're going to talk a little bit more about this and how to address this in the workplace. And then 73% of employees want support from a trusted resource to identify mental health providers. And as a place of employment, you can be that trusted resource for people to be able to find the help that they need and the support that they need. Now let's talk a little bit about the workplace culture and how we can start integrating things on a day-to-day basis. Consistency and follow through are key factors in integrating mental health and making it part of your everyday work culture. So, doing things that you can maintain is super important. Thinking about if employees are virtual, being mindful of how many meetings you're scheduling or attending, and talking with people about your schedule so that you're not overbooking. Making it workplace culture to start or end meetings with a 5-minute window to allow breaks. Many people have meetings back to back in that remote work culture. So, giving a 5-minute window either at the end or beginning of an hour-long scheduled meeting can help allow that break that people need to get up and stretch and not feel pressured to be available and run from one thing to the next. Making it clear that it's okay to schedule time to have emails closed or to have an auto response regarding when emails are responded to. This can help alleviate pressure to respond immediately when working remotely, and that feeling that you constantly need to be available, which makes it difficult to focus. Paying attention in your workplace to the language and commentary. This is something that people don't necessarily always pay attention to, but sometimes the language that's being used communicates an underlying bias about taking breaks, taking time off, attending to people's personal needs, or maintaining that work life balance. So, thinking about what language is being used, especially for leadership and management and supervisors, thinking about how they talk about these things and making sure that you're creating a culture where taking time off is okay and taking care of your needs and your breaks is okay. People not feeling pressured to use their breaks to either attend appointments or to work through those breaks. That's part of that language piece as well. And when people are using their breaks to attend appointments, they don't actually get a break from work, and it can actually increase stress and ability to focus because they're running from one thing to the next. And then thinking about your supervisors and managers, whether you are one, whether you manage a supervisor and managers, or the people that are your supervisors or managers, how do they role model um, the ability to take breaks? How do they role model the culture and making sure that they are supporting people around them? Part of culture and that loneliness factor is really thinking about building connections at work. So thinking about your workplace and how to make facilitating connections through planned activities a strategic priority. This really focuses on enrichment activities, which are more culture building. And when you promote your work culture, it creates a strong relationship between employees. It helps increase motivation, trust, and it really builds a foundation for longer term success. This is very different than team building activities, which is focused on achieving a goal together. And this is really more about the relationships. So when you're doing activities or thinking about your strategic plan for your business, how do you really focus on that work culture and enrichment activities? Also, creating a space for connection at work and encouraging that. How do you make check ins a part of your staff meetings or supervision meetings with people? Making sure that you're checking in about how they're doing just in general in their personal lives and at work in a way that's appropriate for your setting. Scheduling breaks and activities during the workday that include no or low cost activities like taking a walk together, stretch breaks, mindfulness breaks, or having potlucks. And Leslie's going to talk a little bit more about that in the physical aspect of integrating into the workplace. And then creating a gathering space for people, the proverbial water cooler, a space where it's okay for people to sit and talk when they're on breaks and connect with one another, and facilitating a space for that to happen. I'm going to talk a little bit about leadership now. So supporting leadership and understanding mental health is important on all levels and really a crucial aspect to supporting the overall mental health of your employees or your coworkers. Leading with empathy, so really taking the time to be present and understand where somebody else is coming and having compassion for them. Providing training to supervisors so that they feel comfortable talking about mental health. Many supervisors report fear of saying the wrong thing, so they just say nothing at all when an employee is talking with them about their concerns or how their mental health is impacting them at work. So there are some things that you can do to help address that. There's lots of trainings out there for supervisors on diversity, equity, inclusion, and belonging, otherwise known as DEIB. And those are focused on DEIB in the workplace to celebrate differences and help people feel safe in their work environment. There's a lot of those trainings focus on that language piece that I was talking about earlier as well. And then the National Alliance of Mental Illness has collaborated nationally with a program to provide mental health first aid. And they have mental health first aid for adults and adolescents. They are free trainings that supervisors can attend. And it's not about them providing mental health services, it's about recognizing signs and symptoms or concerns that people are bringing to them and feeling comfortable about where to direct them to resources to help support them. This can help people feel more comfortable talking about mental health in the workplace and providing support at an appropriate level. Checking in on others' general well-being as part of your day-to-day, and being genuine with that. Establishing clear work-life boundaries, and what that means is setting realistic expectations so that people can maintain these. Being understanding of what you can get done in a work day and letting people know that it's okay for those things to wait till the next day. Again, that varies across different settings and what that might look like. Role modeling the importance of taking time off. So that's again for some leadership. So you have your PTO, your sick days, encouraging people to take time off instead of stocking it and cashing out, and thinking about how you have those benefits set up and whether it encourages people to do that, and encourages people to use their time or not. And thinking about how when people take time off, that affects them when they come back. And does it create a lot of stress? How do you support one another in that work environment so that people can take their time off and enjoy their time off and come back refreshed and ready to work? Remember that workplace culture and building awareness of language from that last slide, that goes for the PTO too, and the types of things that people say when people are taking time off. Are you telling people to enjoy their time off, or are there underhanded comments that maybe people make, such as, that must be nice to be able to take that time off and things like that. It's very subtle sometimes, but it can create a big shift in your work culture paying attention to that language. Lastly, making sure that benefits is not a one and done at hire or annual benefits time. Helping supervisors be very well versed in benefits so they can recommend them to employees or to talk with HR when mental health concerns come up in conversation. EAP, if you have that, is a benefit that most people don't understand. So if you do have EAP benefits, letting people know and bringing them up often. Most people don't know how to access them. For example, clients will often show up for their first appointment and state that they want to use their EAP benefits. However, your EAP has to be something that's set up and completed ahead of time, and there's only certain providers that take EAP benefits. Not every provider takes EAP. And that's employee assistance programs for people that don't know what EAP stands for. Creating time for your employees to have face-to-face time with insurance benefit providers so that they can ask questions and gain a better understanding of benefits. I can give an example for myself with dental benefits. I worked someplace that I had no idea that I could have 4 cleanings a year until I had had this insurance for like 3 or 4 years. And I happened to attend a benefit meeting where the insurance provider talked about that and shared about that. But it was not easy to find within the benefits itself. So making sure that people have a really good understanding of what's available to them, how many mental health sessions they have, who they can access those services through. Which leads me to providing a resource or network of people that provide the services and are in network with your insurance benefits. That slide that I talked about earlier, that employees want a trusted resource, you can be that trusted resource. And if you have a list of providers that are local to your area that you know accept your insurance benefits, it helps increase access to care. And that list of providers, including their race and gender identity, can be really helpful for people so they can seek out somebody that can meet their needs. It helps not just decrease barriers to accessing care, but it helps decrease stress in trying to find a provider, which can be very difficult in our current society. And it also helps your employees feel supported and that they can reach out to people that are trusted by your company. So now I'm going to pass it over to Leslie to talk about integrating that physical health piece into the workplace.
So, understanding employer benefits also plays a role in integrating and helping to prioritize physical health in the workplace. There are many types of employee benefits. I'm going to just focus on a few that prioritize the physical health, including movement and nourishment, because I'm a dietitian and that's where my expertise lies. So, a few examples of employee benefits, and these are outside just employee health insurance. That you could start exploring as an employer or as a group of employees. So, paid or discounted gym memberships, or even just carving out time in the day for movement as a policy. We know that when people move more during the day, they actually feel more productive and they have less aches and pains. Finding ways to team up with other businesses to reward and offer discounts, maybe to specific stores or activities. And that's just a community building activity that you can do with other businesses. Meal breaks. So meal breaks are a really big aspect, one of fueling for the workday. And as dietitians, we talk significantly about this, whether it's sharing a quick breakfast, coffee with a colleague, or really like coming together for lunch. It's a really important aspect, not just for fueling your physical health, but like Michelle said, like building that workplace culture. This next one is my favorite because my cat is right next to me. Building up, offering pet-friendly work environments. So we have strong data that show that pets can actually help us physically reduce signs of stress. They also help us and remind us to work or to move during the day. So if you bring your dog to work, your dog has to go out every now and then. So potty breaks for your dog also mean movement for you. Another idea is flexible work arrangements. This can look really different depending on the industry. Maybe you allow people to work from home one day a week, or shifting start times, or compressing the work week. Maybe you allow people to work 4/10 so that they get 3 days off during the weekend. Being flexible and coming up with different ideas to make more flexible work arrangements can also help retain staff. Separating PTO, paid time off, from sick time. Okay, this helps people understand that sick time is used for when you're sick, not when you're on vacation, but also for when you're going to doctor's appointments, when you're taking your kids to doctor's appointments. That's different than paid time off where you're actually trying to decompress from work. And the last one on my bulleted list is health insurance, and we're going to get into the nitty-gritty of that in a little bit. But you can't, as a business owner, you can't offer everything. So where should we start? And where do we start where we don't break the bank? So I'm going to focus on the two major aspects of physical health. The first one is movement. Employers can start taking stock of their employees' physical health by observing how sedentary their jobs are. So during the pandemic, we were all virtual, right? We were sitting in front of a computer. Half the time, we wouldn't even move until like 1 or 2 o'clock in the afternoon. This is not ideal. So maybe as an employer, you can start looking at, okay, so how long are people chained to their desks? Is there a way to integrate more movement through the workday? Can you have walking meetings? Can you schedule meetings off-site so you actually have to move away from your desk, go to the parking lot, get in your car, drive somewhere, and get out of your car? The other idea is just putting a picnic table outside of your office. So you're getting out of the physical space of your office into a new environment and also moving. Investing in a standing desk for those that it is appropriate for has shown to be extremely beneficial. In a recent 2021 randomized controlled trial of examining the benefits of standing workstations, researchers found that when employees had access to a standing workstation, they spent less time sitting overall, they had less aches and pains, they physically felt better overall, and they felt like they were actually doing better work and being more productive. So spending $100 on a desk or on a riser to bring your computer station up can be so beneficial. The other side of this is that if we have employees on the call or on the webinar, you can advocate for this. It doesn't hurt to ask. Like, what is the employer going to say? No? Okay, so you move on. Great, but you have to ask. Okay, so that's movement. Fueling. Do your employees have time for meal breaks? And I'm not like saying meal break as in they eat in front of the computer, like on the photo on the left side, even though she has I think that's an apple and it looks like a lovely quinoa salad. She is still engaging in her work and totally unaware of her hunger and satiety cues. So while she is fueling, she is not engaging with her body. So not an ideal situation. On the right-hand side, we have people that are collaborating. Yes, they are eating healthy foods. I planted that picture specifically, but they are also engaging and socializing. Food is so much more than just fuel. It's emotional, it's joyful, it's things that bring people together. So it's an easy way to build a positive culture while also making sure that your employees are fueled for their workday. So what happens when we implement these strategies? We have another poll question coming up, so be ready.
So our next poll question, do you think prioritizing mental health can benefit your workplace? So a lot of people said yes. There's some that are unsure. We're going to talk a little bit about this. And as we're going through these slides, you'll see that there's a lot of overlap between the mental health aspect and the physical aspect and how they impact one another. So there's a lot of strategies that you can apply that benefit both at the same time. So what are some of the benefits of prioritizing mental health in the workplace? Retention. According to a study by Prudential's Missed Connections, Loneliness and the Professional Impact, that's just from this year, lonely employees are twice as likely to quit and have higher rates of absenteeism. Um, so that can really impact your retention in terms of training, orientation, the stress that it creates on other employees covering other people's work and jobs because they're not there or you're trying to find and hire somebody. Employees that are hospitalized for mental health reasons find it really difficult to return to work due to feeling unsupported oftentimes or having concern about losing their job. So there's some fear of returning to work and how other people will treat them or talk with them or talk with them and support them, as well as whether they're going to be able to maintain their job if they had to be hospitalized. And we're going to talk a little bit about some things that you can do in order to support people and decrease hospitalization or potential need for hospitalization. So like I said, both of these things can create risk to employers in terms of cost, as well as create stress for the coworkers, whether that's being concerned about their peer or their coworker, or whether that has to do with workload and how that impacts them. Performance, loneliness can impact your cognitive performance and ability to focus. And performance, the connection piece and performance where you're not feeling as lonely and you feel connected to your peers and coworkers, it boosts morale, it boosts productivity, and it boosts motivation to do a good job and be successful and get things done because you care about your peers and you want to support them and have something positive that is an outcome and not produce more work for them. Being proactive about addressing issues of mental health prior to them becoming a reason to leave or having to deal with a serious condition is a way that you can decrease costs of insurance benefits, as well as impact that retention that we were talking about and performance. So an example, 1 hour of therapy per week impacts productivity less, creates less stress for the employee, and creates less stress for coworkers in terms of having to cover while somebody else is off than having an employee that ends up needing to be hospitalized for a mental health condition and is out of work for potentially a week or sometimes more, or perhaps needing to take some short-term disability time in order to address their mental health conditions. So thinking about providing support for somebody that maybe needs to come in an hour late, return from lunch an hour late, or leave work an hour early in order to be able to make those appointments. There's not a lot of providers. We have a much higher need for mental health than there are providers, and there's only so many hours in the evening that people can work. So a lot of these appointments are only available during work hours and daytime. And, you know, it's different than a doctor's appointment where somebody might go once every few months or once a year. Therapy is weekly or sometimes biweekly, depending on the level of need of the person. So it's important to think about how you're supporting that in order to prevent some larger impacts on your employees or your coworkers. Being able to support that helps reduce stress of the costs for employees. An hour of therapy per week is less costly than needing to be hospitalized or having to take short-term disability and how that impacts finances. And it can also reduce the cost of renewal for benefits plan for employers because when you're looking at the use of proactive benefits versus reactive benefits, if you have a lot of employees that end up needing to use reactive benefits, that increases that cost during the renewal time for benefits. Go ahead, Leslie.
So these benefits also apply to physical health too, which we've been saying throughout. When employers prioritize employees' health, either through a formalized employee wellness program or specific policy changes like we've been talking about, we see a return on investment of lower absenteeism and presenteeism. So remember, presenteeism is the lost productivity that occurs when employees are not functioning in the workplace because of illness, injury, or other conditions. So keep that in mind as I go through some of these statistics. So poor health is attributed to 2 to 3 times greater cost to employers than direct healthcare costs cost an employer. So specifically, employees with poor diets were more likely to have high presenteeism, meaning they were not productive, than those who ate fruits and vegetables and whole grains. When looking at employees with low absenteeism, we see characteristics like good health behaviors. We see good stress management, good biometric data. So think blood pressure, cholesterol, blood glucose, those kind of measurements, and that they're at a normal weight. So research, because we're all about the numbers, research has shown us that for every dollar an employer spends on any type of wellness program, their return on investment is $3.27. So this is kind of huge, right? This is a summary of 22 studies, an average length of 3 years. So we're monitoring these people in these employee wellness programs for years on end, showing that after year 1, after year 2, we're still seeing benefits. So have your employers take that into account when you're, as an employee, advocating for different wellness programs. To further the point, when involving a registered dietitian in your employee's health, we see a number of positive health benefits. So when medical nutrition therapy, which is a nutrition counseling that only can be provided by registered dietitians, not nutritionists, when medical nutrition therapy is utilized as part of the employer-provided group health plan, so that's getting back to your health insurance, employees gain access to high-quality, cost-effective nutrition services that can improve their quality of life and decrease absenteeism. So, you guys know I love the numbers. In adults with overweight and obesity, when medical nutrition therapy was provided, studies revealed an average cost savings, just wait, $52,000 to $990,000 incremental cost effectiveness ratios. So what this is saying is when obesity is addressed, we are saving a significant amount of money in having to care for these people later on. So in that same study, we saw that those that received care from a dietitian, 2.8% of them were admitted to the hospital, while those that didn't receive care, 22.5% were admitted to the hospital. So again, that whole idea that an ounce of prevention saves us a pound in treatment, keep that in mind as we go through some more of these data points. We also see that those who have access to MNT, medical nutrition therapy, enjoy improved quality of life. So this is bridging the gap between physical and mental wellness. It is estimated that an average of 17 years of quality of life gained when utilizing medical nutrition therapy. And then, of course, we see great, like biometric data. So those that participate with a dietitian show significantly lower hemoglobin A1Cs in adults with type 2 diabetes. The average saving for each 1% decrease in a hemoglobin A1C is $246 to $1,600 per patient per year. Research has shown that for every dollar invested in a registered dietitian-led lifestyle modification program, there has been a nearly $15 return. This same trial showed that the mean health plan costs were $3,500 lower with individual and group medical nutrition therapy supported by registered dietitians compared to just usual care. Like, these are staggering dollar amounts. So this is the fuel you can take to your employer to push them to realize that employee wellness programs are a really important aspect of workplace. So how can you help your employees? And for those of you that are employees, how can you advocate for yourself? So we have another poll question coming up.
So there we go. Everybody's reading it, getting their numbers in. This is an interesting question for me because studies have shown that HR and leadership oftentimes think people fully understand their benefits, and the employees themselves think that they maybe understand their benefits, but don't actually realize all of the different benefits that they do have and what things include or how to find those. So 26 to 50%, 100% of people, oh boy. Thanks for taking that poll, everyone. Let's talk a little bit more about accessing and understanding employer benefits. Um, a lot of people don't actually know what their benefits cover or just get lost trying to find the information, so they end up not using those benefits. Um, Accessing needed physical and mental health care to impacts mood, ability to focus, impacts ability to manage stress, depressive symptoms, anxiety, all of those things. So people understanding what they have available for benefits is really important. As an employer or HR person, checking plans' mental health benefits is really important to understanding who manages the mental health or behavioral health, as they call it in the insurance world, the behavioral health benefits. It's not always the benefit provider directly. A lot of times they have a separate behavioral health section. And then finding out, do local providers accept your plan? How many providers are available to see your employees? Are there co-pays? Is there co-insurance or deductibles apply to those mental health benefits? Mental health care can be very expensive, and having to pay a high deductible can deter people from seeking out those supports and services because they can't afford it on a weekly basis, versus having to pay a copay. So making sure that those costs are clear and they're outlined clearly for your employees is important. And then identifying whether there's a limited number of visits per year, or whether there's unlimited visits. People need different levels of support for different varying lengths of time, depending on what their needs are. Um, and lastly, does the benefit plan cover mental health hospital stays or behavioral health hospital stays? And what might that cost somebody if they need to utilize that service in order to stabilize and be able to return to work? Thinking about complementary alternative services is also really important because they can decrease general stress, and provide support. So complementary services like acupuncture or Reiki or massage, things like that, that can help just relax the physical body and help remove some of that stress can be super helpful. Especially when somebody's more dealing with day-to-day stress, which is impacting some anxiety that they might be experiencing. And then there's oftentimes free apps from your insurance that employees can use that people just don't know about, that they can download on their phone. Apps like Calm, Headspace, or Apple Fitness. When I got my new insurance benefits, I found out that Apple Fitness was free, and they have meditation on there, they have yoga, they have things that can help manage your physical body, which then directly impacts your stress and your mental health. Movement is a really important piece of managing depression and anxiety and other mental health diagnoses. So, how do you make sure that people are aware of these and able to access them on devices? Making sure that you as HR, if you as an employee are aware of a benefit, sharing that with your coworkers, making sure that they're aware of those. All of that's really important. And then that PTO piece, we're coming back to it again because it's really important. Um, Encouraging people to use PTO so it doesn't just build up and get cashed out at the end of the year. Thinking about how your cash out plan is set up. Um, are you thinking about the fact that a lot of times, and I'm not going to pretend to understand the financial piece of this and why they're set up this way, but thinking about at the beginning of the year, if you want to cash out PTO, you have to make that decision oftentimes at the beginning of the year, and then you don't have that PTO throughout the year to use if needed, whether that is vacation time or that sick time, depending on how you have that set up. But having people take that time off helps them to connect with themselves. It helps them to connect with their families. It helps them to be able to come back to work and feel more productive. And supporting that is really important, and working to decrease that culture of people feeling like they can't take time off. We are one of the only countries that don't have extensive time off, and thinking about how that affects people and their stress levels and their ability to take care of their mental health is important. Leslie also talked about sick time, and if you have that separate, thinking about sick time as mental health days are part of sick time. And oftentimes people feel like they need to be terribly physically ill in order to utilize sick time, but thinking about and making sure people are educated on these are the different things that sick time can be used for and are encouraged to be used for. And sometimes people need a mental health day because of the stress that they're experiencing, or their anxiety level is high, or they're having a hard time getting out of bed that day because of their depression. Being able to feel supported and utilizing that time that they have available to them to take care of themselves helps them feel supported at work and more engaged and wanting to be successful and motivated at work. So understanding those health insurance benefits is important for both that that mental health and also that physical health, combining those words there.
I like that.
the physical health. That's our theme today.
Yeah. So staying in the whole health insurance realm, one of the best ways to promote physical health at work is to encourage the utilization of your health insurance benefits, right? That's what we're talking about. Most people think of physical health by going to the doctor, right? Like we go to the doctor once a year to have them tell us that we're okay. But there's so much more your health insurance plan can do for you from a physical standpoint. So the first step is figuring out if your employer is offering an Affordable Care Act compliant plan. And the reason why I'm really kind of harping on the ACA plans is that part of the Affordable Care Act was to alleviate cost sharing or any type of additional cost to the utilizer for preventative screenings. So the first step is to speak with your insurance broker or your human resources department or whoever implements your health insurance plan. There should be no cost sharing for an ACA compliant plan for preventative services. And on the screen, you'll see a list of different preventative services. So screening for blood pressure. If we can catch hypertension early, we can treat it without medication. Same with diabetes. When you start seeing your hemoglobin A1C elevating, we can make lifestyle modifications that are so much less expensive than starting insulin. Cholesterol, same thing. We can reduce the risk of heart attacks and cancer. Other preventative services are counseling on smoking cessation, weight management, even just better eating. Mental health and substance use, it gets a little bit more complicated for how to utilize your preventative benefits there, but really leaning on whoever is the broker supplying your insurance plan and making them answer your questions. Routine vaccines, I have some staggering data on what happens when employees get their routine vaccines and how cost effective it is for employers. Prenatal care, as someone who is hitting 32 weeks tomorrow, I completely understand the importance of prenatal care to be able to work through my pregnancy and stay healthy enough to be a contributing member of my business. And then post-pregnancy, making sure my kids stay healthy too. Well child visits. The no cost sharing for those is really important too. So by eliminating cost sharing, one study found that the rate of women getting mammograms went up as much as 9% when that cost sharing, so that out-of-pocket cost, was eliminated. 9 million workers report missing days due to illness each year, reducing economic output by $260 billion. We cannot ignore the fact that we need to address employee health and also address the costs associated with keeping employees healthy. One of the major healthcare cost drivers is the rise of obesity and its related illness. Individuals who are obese or overweight have increased healthcare costs 39% above average. By providing obesity reduction services, and that's not just bariatric surgery or GLP-1 inhibitors, that can be lifestyle modification. We could reduce the disease burden to also then lower the cost of premiums 0.5% to 1%, which can be significant over time depending on how big your business is. We also know that for every dollar we spend on immunizations could save $5.30 on direct healthcare costs and $16.50 on total societal costs of disease. Okay, so that's a big one. Immunizations are a cornerstone of preventative healthcare. Tobacco use screening with a brief intervention was found to save an average of more than $500 per smoker. So we have the data to show that these preventative services work. Now it's really important that we integrate them into our lives and into our workplace. So as employees, we need to advocate for time to utilize these features, but also making sure scheduling these appointments are just as routine as getting an oil change. We take care of our cars better than we take care of our bodies. So keep that in mind. So in closing, we covered a lot today. This is our list of citations and resources from our presentations. The chamber will email these out to you so you have them handy. So look out for that email.
And I just want to, with those resources, really encourage people to read the LIRA 2024 State of the Workforce Mental Health Report. It is a long report, but it has a lot of data, and it's very, very interesting. This company, all they do is workplace mental health. That is their area of focus. So there's a lot of really helpful information. So next, we're just going to talk about how to reach us, and this is my information. The email that is LEME, that one goes to myself and our franchise owner. So if I'm out of the office or you have a general question, you can still get an answer to that. And then down below that, there's 2 different phone numbers. The client access team is how somebody can reach out to schedule with a provider or see if we have somebody that has openings that fit your schedule and can take your insurance. So that is a way to schedule an appointment, versus the number below that is my direct line. So if there's questions that you have from this presentation or want to reach out or want to talk a little bit more, you can reach me at that number or my email. Some of our services that we provide are over on the right here. This is not all inclusive. Each of our providers has their own area of specialty, and they have their own schedule, and each provider can take different insurances based on their licensure. So this is just kind of a general list of things that we can provide services for at our office. And this next slide is our current providers. So we have a variety of different people with different areas of specialty that you can see here. They're available at different times of day. And hopefully if you need services or you know somebody that needs services, hopefully one of our providers is a good match for you. But if not, we also have lists of places to be able to seek out services, because the goal is being able to support people in finding a provider, and that doesn't necessarily mean it has to be with us.
Same lines for us at Nourish Lifestyles. Please don't hesitate to reach out. There are many things that a dietitian can help with on the individual level, but also on the business level. Nourish Lifestyles offers I call them lunch and learns because it's fun to talk about food at the middle of the day. But opportunities for businesses throughout Southern Maine to really help understand the importance of fueling for the workday. And one of the things that's wonderful about Affordable Care Act compliant plans is that seeing a dietitian is seen as preventative services. So over 90% of our clientele pay no out-of-pocket costs to visit with us. On the screen, you'll see a ton of different ways a dietitian can help on an individual level. If you're interested in collaborating with us to build a stronger employee wellness presence at your organization, please go to our website and schedule a discovery call with me. I'm happy to talk with any and everyone. Here's our crew. Just a reminder, dietitians are registered and licensed in the state of Maine. We have the strongest consumer protection aspects. We are not nutritionists. We have a variety of different expertise on our team. And then time for a couple of questions. So I know we have some questions in the chat. So with the last couple of minutes, I'm going to read those aloud. I think the first one, Michelle, might be more of your experience. So the question is, have you ever had a poor experience with an employer when advocating for your mental or physical health in the workplace? If so, how did you manage that in a professional way?
I think that
that's a tough one.
Yeah, it is a tough one. I think that what can come up is people not feeling heard or their concerns being validated. And sometimes when people need to take time off because of mental health, oftentimes it's not something that you can physically see. And so people, that language that I was talking about being used, that can be really hard. So talking with a trusted supervisor and talking about like what is my protection with my employer, what are my benefits, what do I have available to me, and then maybe talking about how can we work together to make mental health a part of our work culture in terms of being able to talk about it more openly and provide support to one another. And some of those trainings that I had talked about is a good way to do that. I'm not sure if that quite answered the question, but continuing to just talk and have those conversations and changing and shifting that work culture if there is a more negative tone and language to advocating for yourself for those areas of need.
I think the other important aspect of that is making sure that you document when and how you speak with your supervisor, whether it's over email, whether it's a log, just to have that. And then also you can also lean on your primary care provider to also give you a doctor's note, essentially, so that you can have some evidence. I think that might be powerful as well. Our next question is, what is your perspective on unlimited PTO? I've heard that it actually doesn't benefit the employee because they aren't technically, quote, required to take minimum PTO on an annual basis. So I have to admit, I have not heard of this. I run a small business and we're super flexible. So I guess that they have unlimited PTO. Michelle, have you seen or heard about unlimited PTO and how it's utilized?
Yes, we don't have unlimited PTO here at our office, but I do know some other LA offices that do use the unlimited PTO perspective of time off, and some other places as well, not just LA's. And I've heard mixed reviews about it. Sometimes people, because it's unlimited, they monitor for people kind of taking advantage of that and not being at work a lot, which creates stress on their coworkers. But then in other cases where people don't feel that quote unquote pressure to take that time off, like it's not a use it or lose it. So in our culture, we tend to be people that want to get things done and show up, and we work on kind of a instant gratification culture. So a lot of times, depending on that culture at work, if it's encouraged to take time off versus being at work and getting stuff done, and that's the general expectation, that can impact that time off and people actually utilizing it. So I think a lot of this has to do with the culture that you're creating at your work. And it can be beneficial, but there's definitely some places where you have to really think about how it's structured and how you are encouraging people to use that time off and making sure that they have the space to do that without it creating more stress.
I think one of the things we highlighted in our presentation is the aspect of educating employees on how to utilize PTO, whether it's PTO for sick time or for vacation. This is one of the things why I like to separate sick and vacation time, so that we can really help employees understand that, like, sick time is for taking care of your health. and vacation time is for decompressing and slightly part of your mental health. But I think when we see it not working, maybe it's an aspect of an educational gap with employees being able to utilize it. So I wonder how those businesses explain that to PT or to their employees.
Mm-hmm.
I don't see any more questions.
I have just kind of a wrap up that I'd like to share. That's not part of our slides. I'm going a little rogue here. I talked at the beginning about you can't do everything at once, and that consistency and follow through is an important piece of having a culture change. So we talked about a lot of different things between Leslie and I today, and I would encourage you as either an employee or an employer to focus on maybe one or two things that really stood out to you or were meaningful to you, and think about how you can make a consistent change in your workplace to address a couple of those areas and make it part of your culture. And then once those are up and rolling and they have become more routine and you don't have to put as much work into them, maybe then think about incorporating a couple more. Again, doing something one time does not create a culture change. So really focusing on what you can be consistent with is important.
Well, thank you so much for that. That was I'm glad you added that in at the end, Michelle. And I like the emphasis on advocating for yourself and also as an employer, educating your employees, because that's advocating for your business and that culture that you want to have within your business. Thank you for an incredible presentation today. And of course, thanks to my colleague, Riley Legier, for helping to produce yet another successful virtual event. Thanks again to each of you for attending and throughout the year. If you are interested in continuing the conversation with Leslie and Michelle, as I mentioned earlier, we will be sending a follow-up message with links to additional resources, contact information, etc. And I'd like to also give another shout out to our sponsor, Eaton Peabody, for their support of this series. The Eaton Peabody Growth Basics for Business series is typically held on the third Tuesday of each month. We look forward to seeing you again on May 14th for the next Growth Basics for Business, when you'll hear from business coach and headshot and portrait photographer Will Wooler about how building and refining your client experience leads to both client success and the success of your business. So with that, thank you again for attending today's event. Have a wonderful rest of your day.